I think the pyramid model has been very helpful in regards to focusing where we were going to put our priorities and looking at the bottom pieces of the triangle, in particular the nurturing relationships, and even before that, sort of the workplace or the workforce development, recognizing that young children really need high-quality staff members that are well-trained in order to implement the bottom pieces of the triangle. The more exciting part for me is probably the preventative part of the triangle, building those nurturing relationships for children and making sure that we have positive outcomes for all of our kids. Also, you know, as a person, like, for all of us with the funding issues, we have lots of different challenges to maintain and lots of job responsibilities to fulfill. And having an evidence-based practice model cuts to the chase for me as a mental health specialist. I already know what the evidence tells us, and it's really a question of moving forward with that and being able to work with the staff and provide training and technical assistance with confidence that this is going to make a difference in the outcome, ultimately, of the lives of our children, but more short-term in the management of their classroom. And so I think that those pieces have been huge. And we've literally seen the behavioral issues go down in our classroom. In terms of our overall classrooms, I think we're seeing a much more positive environment for children. I think we're seeing staff that have confidence that they have the skills to manage those things. I think we're actually seeing the improved outcome for children. And really, our focus has changed to that preventative piece, which is being more responsive, working on developing the nurturing relationships, promoting resilience in kids, really doing the front end, front-loading the system, so to speak, so that their social-emotional development is met, their attachment needs are being met. All of those really solid pieces that they're going to pattern their future relationships on are being met through that preventative piece. And that instead of the more sort of firefighter approach, as I sometimes call it, where I feel like I've been asked to respond to crisis situations, it's been really refreshing to be able to go in and provide technical assistance to the teachers about what kinds of classroom support should be in place to enhance the social emotional development for all kids. One of the children that really comes to mind when I think about the pyramid model is this little boy that we have. He's now just turned 3 and transitioning to our preschool program, but we got him when he was a little bit over 1. He was born drug addicted. His dad was nowhere to be found. His mom then was incarcerated. Dad came into the picture and decided he was going to take custody of this child. All kinds of trauma, police, drug dealing. When he first came into our care at 13 months, and he would just stand by the window and cry all day for a caregiver, for somebody to love him. And our teachers would go up, be at eye level, try to make a contact and build a relationship with him. But the wall was already coming down at 13 months, and you could just see that he was increasingly becoming more and more unreachable. His mom had another baby. He got whisked to Massachusetts. The caregiver kept working with him. And finally, we started to see a breakthrough. And when he got dropped off, he would go to the caregiver. When he got hurt in the classroom, he'd run to the caregiver. And this child, who we really wondered if he had some cognitive and developmental delay issues, suddenly was just coming out with the most amazing stories. And he would remember books that had been read the day before. And he found comfort in repeating the routines and the transitions. And, I really feel like there was a huge breakthrough with him. There's no doubt in my mind that we have provided him with some incredibly valuable building blocks that set the stage for other good things in his life. And it may be 4 or 5 years before he has another caregiver who can make that kind of connection with him, but there's a place in his brain that is capable of using that intense bonding relationship to pattern other relationships.